Our entire planet is facing an age wave like we've never seen before in human history. You go back to around the year 2000, there were 600 million people over the age of 60 on the planet. And those numbers are gonna double to 1.2 billion by 2025. And then if you just fast forward 25 more years to 2050, it's gonna be over 2 billion people over the age of 60. 860 million people on the planet today with chronic disease, and that's just gonna get worse as an epidemic of chronic disease grows as the population gets older. We've got to figure out, how do we do care differently? How do we use technologies to do care in a way that's going to keep people in their own homes and out of the hospital? How do we do early detection and prevention of disease? How do we leverage informal and family caregivers who are doing a lot of care already? We're under no illusion that technology is some magic pill that's going to solve all these problems, but it's certainly got to be part of the solution as we figure out how are we going to get ready for this age wave.
I don't depend on anybody for anything. I like to do my own thing. But years ago, you looked after your parents, you didn't put them into a home or anything like that. Whereas nowadays, people are in homes and they're not prepared, the young people are not prepared to look after their parents.
Well, our health is the most important thing.
It's all you have at the end of the day, money doesn't matter.
Since 1999, our social science team at Intel has studied and lived with over 1,000 households in 20 different countries and over 150 hospitals and clinics. And if you look across these studies, this overwhelming response from people is, I need technologies to help take care of my aging parents, or, I've just been diagnosed with a chronic disease. Give me technologies that can help me manage that. Intel's approach to healthcare and research is quite simply interdisciplinary. We've got a group of social scientists, a group of engineers, a group of designers who all work together to try to understand the needs of real people and bring data back from the real world to sort of say, how can technology solve those problems?
It's innovation outside in. We're trying to go out into the world and understand what is going on, and then as a company to bring that inside and say, okay, where's the meaningful role that we can play?
I don't think of the people that we study so much as research subjects. They're really co-inventors for the future of technology and aging. We've long believed in an evidence-based approach to the research that we're doing in healthcare. We can't just invent a bunch of technologies, throw them up there, and hope that they work. We have to do longitudinal, large-scale pilots and trials to really see, do these things help with early detection? Do they help save costs in healthcare? So we've done several of these technology pilots with seniors in their homes. The first was focused on social health with people with Alzheimer's to help them stay socially active. The second was called CAMP, or context-aware medication prompting, to help people take the right pill at the right time. And the third was focused on Parkinson's disease, where we took a lot of tests that are done clinically, but once a year with their doctor, and put it in a device that they can do every day in their own home. Intel can't do this all alone. We've got to figure out how to bring together an ecosystem of other companies, universities, government players, providers, associations, coming together to invent these technologies for the age wave, to figure out how technology can help with chronic disease management. TRIL stands for the Technology Research for Independent Living Center. This is an exciting new partnership that we've just launched with Intel, 3 Irish universities, and the Irish government to really figure out how do we bring real science, real credibility, real innovation to independent living technologies.
Probably it'll come sometime that we'll have to get somebody in, or, well, the daughters might be able to look after us, but...
I don't think about that.
No, I don't know, and I don't like thinking about it myself either.
At the end of the day, the only way we're going to save healthcare costs while improving the quality of care is through behavior change. We've got to use technologies that are personal, proactive, to change people's behavior. Ultimate goal of all of our research, all of our product development is, and it's really kind of ambitious, but it's really to reinvent the healthcare system. It's to figure out, how do we make technology be a core part of doing care differently, of scaling care to our aging parents in a way that's really never been done before.